Welcome to this quick guide on coping with the side effects of chronic lymphocytic leukemia. We will cover common treatments, fatigue, infections, stomach distress, skin changes, weight loss, stem cell transplant, tips for living with CLL, support, and coping for caregivers.
Chronic lymphocytic leukemia, or CLL, can affect your energy level, how you look and feel, and your emotional health. If you are in treatment, you may experience side effects from treatment now or in the future. CLL can also have an impact on other aspects of life, including your financial health. People who care for you may be affected too.
Your experience will depend on the treatment you receive. The main treatments for CLL are watch and wait, drug therapies, including chemotherapy, immunotherapy, and targeted therapy, radiation therapy, and stem cell transplant.
If CLL is not causing symptoms or laboratory problems, your doctor may recommend watchful waiting or watch and wait instead of treating the CLL right away. They will monitor your health closely and look for changes that suggest it is time to start treatment. It can be a relief not to be in treatment, but it can also cause stress knowing that the situation can change at any time. Tests and scans may cause anxiety. Finding ways to relax may help. Try meditation, yoga, or activities you enjoy. Seek support if needed.
Most people with CLL will be treated with drug therapy at some point. Radiation therapy may be used as well. Common side effects of drug and radiation therapies include severe fatigue, infections, stomach distress, skin changes, and weight loss.
Many people with CLL experience severe fatigue. Fatigue is extreme tiredness that does not go away with rest. You may feel weak or have difficulty concentrating. Tell your doctor about fatigue so that they can try to figure out the cause. Fatigue caused by low blood counts may be treated with blood transfusions. If you're not in treatment, severe fatigue may be a sign that it's time to start. These tips may help you cope with fatigue. Drink water to stay hydrated. Eat healthy foods that provide energy. Be active when you can. Take breaks and rest as needed. Keep track of when you have energy and plan activities for those times. Fatigue is sometimes caused by stress or sadness. Talking about it with a counselor or support group may help.
CLL and its treatment can weaken the immune system. This puts you at higher risk for infection. Talk with your healthcare team about what they can do and what you can do to prevent infection. Tips may include hand washing, especially before and after eating and going to the bathroom, getting recommended vaccines, cleaning produce well, avoiding crowded places, wearing a mask, taking care when you cut your nails, cleaning wounds well, and wearing gloves to garden or clean up after pets or children. It is important for people around you to be careful as well.
Cancer treatment can cause stomach distress. Nausea and vomiting are common. Heartburn, diarrhea, and constipation can occur too. It is easier to manage these side effects if you know that they might occur. There are many ways to prevent and treat nausea, both naturally and with drugs. Some can be used in advance to prevent queasiness. Others work better when tried after nausea sets in. Constipation and diarrhea can be managed with certain foods, liquids, and medicines. Talk to your doctor about what to expect and plan ahead.
Treatment for CLL can cause skin changes, such as rashes or itching. These tips may help. Clean skin with gentle soaps and pat dry. Use fragrance-free moisturizers. Try an oatmeal bath for itching. Wear loose clothing. Protect skin from the sun. And tell your healthcare team about skin changes as soon as you notice them, in case treatment is needed.
People with CLL sometimes have trouble maintaining a healthy weight. This may be due to eating less, as CLL can cause decreased appetite or early fullness, or it can be caused by how the body processes food. Here are some tips to help with unwanted weight loss. Eat more frequent, smaller meals. Eat high-protein foods. Add more calories to your foods by adding olive oil, butter, cheese, avocado, nuts, or fruit. Snack when you're not hungry. Plan meals for times when you are most likely to eat. Exercise a little to increase your appetite.
Cancer drugs have other common side effects, including hair loss, mouth sores, fever, headache, and cognitive changes. Learn more about these and other side effects and how to manage them by visiting www.cancersupportcommunity.org/side effects.
If CLL does not respond to other treatments, your doctor may recommend a stem cell transplant. After a transplant, your risk of infection is very high. You may have to limit social contact until your immune system regains strength. This can be hard. Talk with your healthcare team or loved ones to prepare. Transplants for CLL usually involve donor cells. Sometimes this causes a strong immune response in the form of graft versus host disease, or GVHD. GVHD can be mild or serious, lasting for a short time or indefinitely. There are medicines that you can take to prevent and manage symptoms of GVHD. If you're considering a transplant, ask your healthcare team about the risks and what you can do to stay healthy.
In this section, we will cover changes to your appearance, late effects, palliative care, depression and anxiety, eating well and staying active, cost and expenses, support, and coping for caregivers.
Cancer and cancer treatment may change how you look. You may lose weight, develop skin rashes, lose your hair. If you feel uncomfortable, ask your healthcare team or other people with cancer for tips on how to cope with specific changes. People may ask about changes to your appearance. It can help to prepare answers in advance.
Most side effects go away after treatment ends. Some may linger or appear later. Many are mild or treatable. Occasionally, they are more serious. Talk with your doctor about any changes you notice.
If symptoms or side effects become burdensome, ask your healthcare team to refer you to a palliative care specialist. This doctor focuses on managing symptoms and side effects in order to improve your quality of life.
It is normal to feel alone, angry, anxious, or despair. Depression and anxiety can make it difficult to cope with side effects and treatment. Tell your healthcare team if you are feeling depressed or anxious. They can help you get treated for these conditions, which can make a big difference in your daily life.
Eating well and being active can help keep your body and mind healthy. Healthy foods can help you stay strong. Light exercise can help increase your appetite and boost your energy. Ask your healthcare team for suggestions for diet and activity. Find out what exercises you can safely do. Activities such as meditation and yoga can help you exercise your mind and body.
Cancer can be costly. Keeping up with costs can be overwhelming. There are resources that can help. For tips on how to manage the cost of cancer treatment, visit www.cancersupportcommunity.org/cost.
Coping with CLL can cause stress, anxiety, sadness, and depression. Individual counseling and support groups can help you manage those feelings. Counseling may come from a therapist, oncology social worker, or spiritual advisor. Support can be online or in person. The Cancer Support Community's mylifeline.org is a great way to connect with loved ones to help you through treatment or other tough times. You can also call the Cancer Support Community's helpline at 888-793-9355.
Caregivers sometimes focus on their loved one and neglect their own health and well-being. It is important for caregivers to take care of themselves. Many caregivers benefit from support groups. They can talk about emotional issues, share concerns, obtain help, and feel less alone. To learn more, visit www.cancersupportcommunity.org/caregivers.